Now we're going to talk about the skin. So let's do a brief review of the skin anatomy. So we have different layers of our skin. We have the epidermis, dermis, and the subcutaneous fatty tissue. So here, as you can see here in this area, this is the epidermis. So this is the superficial outer layer of your skin. Next will be your dermis. You see how it's a bigger area. So the dermis is filled with blood vessels, the nerves, and hair follicles. So as you can see here, so this is a hair follicle. You have the vessels and some nerves. Under the dermis, you have your subcutaneous tissue over here, or your layer of fat. And within your skin, you also have your sweat glands and sebaceous glands. So the sweat gland is your eccrine sweat gland over here, and the sebaceous or oil gland is usually found close to your hair follicles. Now let's talk about acne. So how does acne develop? So acne is basically an inflammatory process of the sebaceous gland. So oftentimes it involves clogging, right, or filling up of that gland, and so it has nowhere to go. And anyway, so it can be in two forms. So you can have an open comedone or a closed comedone. So open comedone is considered as your blackheads, and your closed comedones are your whiteheads. These are inflammatory lesions, at times consisting of papules or pustules. So papules are basically fluid-filled lesions. Pustules are pus-filled lesions. There are non-pharmacologic treatments. So one is a comedone extractor. So physically extracting with some instruments, right? You can extract those comedones. Now there are dermatologists that don't actually recommend that. And if you decide to do that, I would actually discourage you to do that. But there are dermatology clinics that would do that for you, because again, the risk for that is possible infection or worsening of the area. And especially if it's within the face, right? You want to make sure you do it correctly to prevent infections, but also to prevent scar tissue formation. In addition, sometimes other non-pharmacologic treatment includes watching our diet. So certain types of diet can put us at a higher risk for developing acne, and maybe trying to consider our laundry detergent, right? Especially if you have a very sensitive skin, and any other irritants. But again, diet and then maybe hormonal balance can actually affect acne formation. That being said, let's say we tried all the non-pharmacological treatment and it doesn't work. Then the next thing to consider will be your pharmacological treatment. So for the pharmacological treatment of acne, the mechanism of action include bactericidal activity against susceptible microbes. So commonly, whenever the pores are clogged and it forms either open or closed comedones, what happens next, the secondary thing that happens, is bacterial infection. So that actually makes the acne worse because it causes swelling, and again, it can create pustules. And so one way to treat that is through antimicrobial, which has bactericidal properties or activities. Other mechanism of action can include either oral or topical routes of administration of certain drugs. Therapeutic effect mainly is to eradicate or treat the infection, and it also helps clear the skin. Indications for pharmacologic treatment is acne vulgaris, or acne caused by bacterial infection, and specifically for Accutane. So Accutane is not the first line of treatment, right? So that's not the first thing that we have to administer to our patient, or the provider orders immediately after they have acne. So Accutane is the last resort for cystic acne that is unresponsive to other agents. Some precautions and contraindications. So the reason why we don't prescribe Accutane for acne as frequently or as a first line of treatment is because Accutane is a pregnancy category X. So meaning it's teratogenic. So it can cause some malformations of the fetus. Retin A is topical, and Retin A can actually cause some irritation. So it's very irritating to the skin. It makes your skin sensitive to the sunlight, and it's easier to acquire sunburn with that. Some side effects, as mentioned earlier, acne medications can cause skin irritation, rash, and itching, but mainly Accutane. So you have to remember this. So acne should be significant because of these possible side effects, right? We have to weigh risk versus benefits, because the risk is if we start giving Accutane to our patient, they're at risk for developing depression. It increases their suicide risk. It causes skin dryness, inflammation. It can also lead to conjunctivitis and as well as abdominal pain. Nursing action: always assess for therapeutic and side effects, and patient education. So again, our first line, the first thing that we have to do is recommend to our patient any lifestyle changes. Maybe avoid eating certain types of food that can cause a flare-up of your acne. Correct use of the medication and proper dosing. And specifically for Accutane, there is this website. It's called iPledge. This is basically a website where the provider registers the patient, and so it gives all this information. You have to put in all the information, but basically it ensures that the provider is following the proper guideline, wherein a woman who is prescribed Accutane should be on 2 forms of birth control, and in addition, they have to have 2 negative pregnancy tests, one prior and the second one right before their next appointment or follow-up. So they're very strict because, again, this drug is extremely teratogenic, or basically causes malformation of the unborn child. Examples of drugs under this class is your Accutane, which is isotretinoin, and you also have benzoyl peroxide. So benzoyl peroxide would be your topical agent. All right, next topic, lice and scabies. So these are parasites basically. So as you can see, these are bugs. So this is a magnified picture of a male and female lice. And as you can see here, these are the eggs or the nits. So usually they're stuck on the hair. So pathophysiology. In a little bit, I'll show you a picture of scabies. So lice or pediculosis, these are parasites that suck blood, and they often leave excrements and eggs on the skin and hair. So that would be the nit. Scabies is also called Sarcoptes scabiei, which are mites that penetrate the skin. So they burrow. So they're inside the skin and they deposit their eggs. So the effect of that, so lice, mainly it's a reaction to the sucking of the blood and also the excrement and the eggs. It causes some redness. Sometimes it causes papules, formation of some lesions or wheals. So it causes itching and excoriation on the scalp, or wherever it is, because sometimes it's not only the scalp, because you can also find lice anywhere else where hair is present. Scabies, on the other hand, they're very similar because they're very itchy. As mentioned earlier, scabies, they burrow under the skin, and usually the symptoms are from the allergic reaction from the eggs, right? Because they burrow in there and they deposit their eggs under your skin. So it causes severe itching, and it's mainly in the folds or interdigits. So the fold in between each finger. So pharmacological treatment for these conditions or these parasites. In order to eradicate this, we administer ectoparasiticidal, or basically they are considered pesticides. So they are pediculicides and scabicides. Pediculicides and scabicides. The therapeutic effect. So this is not one thing that you want a bacteriostatic agent or prevent them from growing. Therapeutic effect for this treatment is really to kill these insects or parasites. Over here you can see this is often the area where scabies burrow their eggs. So you see here, so it's in the folds, interdigital folds, and as you can see here, this is located on the wrist area. So they're very tiny, they're very small, they're microscopic, you won't be able to see them, but the patients will really feel them. It's extremely itchy and uncomfortable. So indications for these agents is to correct. One, we need to make sure that they're the right parasites, right? So these are for lice and scabies. Precautions and contraindications, this will be dependent on the agent that we are using. But just remember, because these are parasites, right? Our intention is to kill these organisms. Usually the side effects can be quite extreme in a way if we are not careful when administering these agents. Side effects. Side effects of the drugs or agents that we use for scabies and lice include skin rash and irritation. So they're very irritating. Lindane can cause CNS toxicity, so it can cause dizziness, seizure, and aplastic anemia. So as you can see, these are very dangerous, and so we have to be careful making sure, especially if it's given to a child, that they don't ingest it, that we don't expose them unnecessarily. So if the direction says 8 to 14 hours, we need to avoid exposing them for a longer period of time than the recommended. Now, ovide or malathion is another agent. It can cause cholinergic toxicity such as nausea, vomiting, diarrhea, abdominal cramping, incontinence, meiosis, which is pinpoint pupils, bradycardia, and increased secretion. So as you notice over here, these are your cholinergic effects, right? The cholinergic side effects. You guys remember sludge, right? So this is basically what happens. It's a side effect of malathion or ovide. Nursing action, we need to make sure that we're assessing for therapeutic and side effects, and maybe lifestyle changes, and also making sure that they're using the right drugs and that they need to follow up. And if possible, if needed, we need to retreat the patient. And lastly, we need to make sure that not only we treat the patient, but we also have to treat the family members or the members of that household, because if we don't treat everyone, they're gonna just keep on coming back because it's contagious. Examples of drugs under this class or that treats lice and scabies is your permethrin. So permethrin treats lice and scabies, and so we just need to make sure that they stay on. So the product needs to stay on that area or areas for about 8 to 14 hours, and then we wash it off. Lindane or Quell is a lotion or shampoo, and malathion. So malathion is not one of those first agents because of the severity of the side effects, right? It's not the first option for lice and scabies. But let's say they tried permethrin and lindane and it doesn't work, then we can consider malathion. So malathion is used if the lice and scabies are resistant to treatment with permethrin. Another one would be your RID or pyrethrin combination shampoo and foam suspension. Alright, so lastly, MRSA or methicillin-resistant Staphylococcus aureus in the nares. The population at risk are usually the hospitalized, the people living in a long-term facility or group home setting, because these are usually immunocompromised, and when you're in a really tight environment, it's easier to transmit that bacteria. The way we screen it is through a nasal swab. So another common population that we screen is any patient admitted to the intensive care unit. So it just requires swabbing the nose and then sending it to the lab, and then it will come back. So it will basically detect whether they have MRSA or not. Anyone can have colonization of MRSA. So colonization means that there's a colony present, right? So the bacteria is present, but it's not causing an infection at that moment. But we need to treat the high-risk population, especially the immunocompromised or the acutely ill, because even though, let's say, it's just initially a colonization, it can actually lead to an infection because of their weakened immune system. So how do we treat nasal colonization of MRSA? We use mupirocin or Bactroban. So this is an ointment that's applied in that area or in the nasal cavity.